Hello everyone. Today's lecture is going to be over Chapter 25 out of your F.A. Davis book over diagnostic tests. And again, the PowerPoint is just an overview, so make sure that you are reading your chapters, completing your end of the chapter questions, and also working on the correlating workbook pages. Diagnostic tests are tests and exams that help to make a medical diagnosis by ruling out other possible diagnoses or by specifically pinpointing the disease process or injury affecting the patient. The nurse's role in diagnostic tests includes noting the healthcare provider's order and making sure the correct test is what the provider actually ordered. Occasionally, nurses will schedule the test or procedure. A big part of the nurse's role in diagnostic tests is educating the patient about the process of the testing, what they need to do beforehand, what they need to do afterwards, what they can expect, things like that. Administering laxatives or enemas, making sure that written consent is obtained if the procedure requires it, knowing when to withhold food and fluids, preparing the patient, maybe shaving an area or washing and cleaning an area, assisting with the performance of the test or the procedure. Categories of diagnostic tests include laboratory tests. Laboratory tests are exams performed on body fluids, such as whole blood, serum, spinal fluid, sputum, urine, gastric contents, feces, and bone marrow. Radiology and imaging tests and procedures, such as MRI and CT scans. Ultrasonography, such as an echocardiogram, that's where ultrasound waves produce images. Endoscopic exams, such as an EGD or colonoscopy. And graphic recording tests, such as an EKG. Okay, and then this slide is talking about all the lab tests, which I mentioned in the previous slide are exams performed on body fluids. There's hematology, where they test the blood and they get a blood count, or a CBC they call it, complete blood count. There's a white cell count and differential. Maybe you've heard them say CBC with diff. When white blood cells are elevated, it's called leukocytosis. If white blood cells are decreased or low, it's called leukopenia. And the differential part of that test, the differential is the breakdown of total white blood cells into 5 white cell categories. Each becomes elevated in response to different situations. So, for example, neutrophils, if they are elevated, that's an increase in infection, a bacterial infection. And they also call that a left shift or banded. Eosinophils, when that portion is elevated, it indicates an allergic reaction or parasites. So back to the neutrophils, the first one, that's spelled Neutrophils. So again, that's also referred to, when those are elevated, that's referred to a left shift, and it is indicating a bacterial infection. Okay, then the second one I named was eosinophils, which is spelled eosinophils. That, when those are elevated, is indicative of allergic reactions or parasites. Next is basophils, basophils. When they are elevated, it's an indication of an increase in histamine. Maybe, for example, the person had a bee sting and the histamine level has gone up. Next is monocyte, which is monocyte, and that also is indicating a bacterial infection. It's a second line bacterial infection. And then finally, lymphocytes, lymphocytes. And that, when the lymphocytes are elevated, that's also referred to as a right shift, and that's an indicator of viral infection and allergic reactions. Okay, and then the red cell count, that's telling us the number of red blood cells in a cubic millimeter of whole blood. Hemoglobin will help us to determine the presence of anemia. A hematocrit helps us to assess the patient's hydration level. Getting back to the hemoglobin, one thing I wanted to say about that, the hemoglobin, again, determines the presence of anemia. And I guess that was all I was going to say. Okay. And then let's see here. Platelet count. Platelet count, that's looking at the blood cells that aid in clotting. More laboratory tests are the blood chemistry tests. Those include blood glucose, which can indicate diabetes. Blood glucose can also go up with stress. They look at electrolyte levels, including potassium, sodium, chloride, magnesium, calcium, and phosphate. Again, potassium, sodium, chloride, magnesium, calcium, and phosphate. They can test enzymes and isoenzymes. These are released and therefore elevated when tissue is injured. A blood urea nitrogen, or a BUN, some of you may have seen or heard this in your workplace. That elevates with some medications like aspirin or antibiotics. It also can be elevated when a person is on a high protein diet. Serum creatinine, that checks kidney function. A total protein can diagnose malnutrition, dehydration, severe burns, GI disease, liver disease, and diabetes. And if protein levels are low, a person can have edema. So again, total protein helps to diagnose malnutrition, dehydration, severe burns, GI disease, liver disease, diabetes. And then the last one listed on here is a total bilirubin, and this is released during destruction of hemoglobin. And if the total bilirubin is elevated, the skin will have an orange tint. Some of the other blood tests are B-type natriuretic peptide, which they refer to as BNP. That's used to diagnose congestive heart failure. Cardiac enzymes are used to determine if a myocardial infarction has occurred or an MI. Lipase helps with the diagnosis of pancreatic disease. And then glycosylated or glycated hemoglobin, which is also known as an A1C, gives us an indication of the average glucose level over a period of 3 months. Okay, urine tests include a urinalysis. We can find out about the renal system through a urinalysis. We can get an indication of dehydration. We can find out if there's bacteria. We can also find out if they're diabetic through a urinalysis. So it's a very useful, simple test. And then the glomerular filtration rate, or the GFR, is the most accurate testing for evaluating kidney function. And it involves a 24-hour collection of urine. And it actually checks creatinine levels. And all of these tests that have been on these last few slides, I believe, are on page 509 or 510 in your book. So make sure you're reading through all of those. They're all very interesting. And then radiology and imaging tests include a chest x-ray. A chest x-ray shows us not only the bony structures of the thorax, but it also shows us heart position and size. It tells us if the lungs are clear or congested, expanded or collapsed. And it also can show densities that might indicate a tumor or tuberculosis. And then the flat plate of the abdomen, or the KUB x-ray, that's actually explained in an upcoming slide. It's one of the questions as part of the PowerPoint. And so you can, if you want to save yourself some time, you can look at that upcoming slide to get the explanation. But the KUB stands for kidney, ureters, bladder. And as you can see here from that answer, it provides information like obstruction of or excessive gas accumulation in the intestines, tumors, kidney stones, or fluid collection in the peritoneal cavity, known as ascites. So fluid collection in the peritoneal cavity is known as ascites. And it says that the KUB is often the initial diagnostic tool when an abdominal organ disease is suspected. So again, that's on an upcoming slide that you can read that off of. And then the magnetic resonance imaging, or MRI. That is an evaluation of the brain, spinal cord, bone, organs, vessels, and fluid-filled soft tissues. And during the MRI, I'm not sure if anyone has ever had one, but you'll hear a series of loud clicks and knocks, and also you'll be going into a smaller area. And so that's something that the nurse can do, is inform the patient what to expect. The other thing about MRIs is you want to ask them if they have any metal in their body, say for example if they've had a knee replacement, or if they're claustrophobic. Those are all things that need to be taken into account before having an MRI. And then computed tomography, or a CT scan, is basically an X-ray from different angles. One thing about the computed tomography is that you need to ask if they have any allergy to iodine and contrast mediums, as well as shellfish. Arteriography and venography. With this type of testing, you can view blood clots and tumors. And one of the nursing interventions for the arteriograms and the venograms is that once the test is done, the person has to stay on bed rest for 6 to 8 hours afterwards. For example, if they did a femoral arteriogram, then the person has to lay flat for 6 to 8 hours. I'm sorry, guys. I think I just accidentally advanced to the slide a couple of slides, but it was just asking. Let me just finish up here with the radiology and imaging tests. The last thing I was going to say on that slide was about the ultrasonography, which that utilizes ultrasound waves to produce images of organs and tissues that can be recorded and printed. And then the next slide that jumped over was just asking about the kind of imaging test in an X-ray of the abdomen that shows structures and positions of the abdominal organs. And the answer is the KUB, the slide that we're on right now. Okay. The end. Okay. We know the answer to this one. We just got done talking about it. We know that it's the capsule endoscopy. And then the last slide is talking about the graphic recording tests. And the first one is the electrocardiogram, or ECG. It's when electrodes are attached to the chest, arms, and legs to check the heart's electrical impulses. Okay, there's also something called an exercise stress test and a chemical stress test. And then the electroencephalography, or EEG. Okay? That's when they put electrodes in the scalp and they record electrical activity of the brain, or brain waves. And this can help diagnose epilepsy, tumors, central nervous system diseases, and also it can confirm brain death. And the one nursing intervention that you have to do for the EEG is you have to confirm that their hair's been washed before you put these electrodes on there, and then make sure that no sprays or products have been reapplied. Okay, the book also goes on to talk about a few other graphic recording tests, such as telemetry, and I'm going to talk just very briefly about those. Telemetry is a portable heart monitor, and I'm not sure if any of you have ever had a patient that was utilizing telemetry, but sometimes there can be a poor tracing or a poor recording, and usually those recordings are shown at the nurse's station. And so the first thing you want to do if you see a poor recording or a poor tracing is not to assume that the person is having a cardiac issue, but instead physically walk down to the room and check, because sometimes those little electrodes are off a little bit, and then that shows a poor tracing. And then there's also something called a Holter monitor, and that's an even more portable heart monitor. It's worn by the patient at home, usually for 24 to 48 hours, and it must stay on continuously. A paracentesis is talked about, and a thoracentesis in the book. A paracentesis is perforation of a body cavity with a hollow needle in order to remove fluid or gas. And when you do a paracentesis, you want to monitor the blood pressure. And then another test that they talk about here is the barium enema. And that's when a contrast medium, barium, is instilled rectally for radiographic visualization of the large intestine. And so when this is done, of course, they've instilled this barium into the rectum, and so afterwards, one of the nursing interventions is to encourage fluid intake. So this is the end of chapter 25 lecture. Please don't hesitate to reach out to me if you have any questions about what I've talked about. It was a somewhat short PowerPoint, but it has a lot of good information in it. So make sure you read your book.